Which of the following antibiotics is the most appropriate choice for initial treatment? Okay. 58-year-old woman has a history of cirrhosis, presents with abdominal pain and increased abdominal girth. She is febrile and appears uncomfortable. Diagnostic paracentesis is performed, which reveals a polymorphonuclear leukocyte count of 300 cells. Physician initiates empiric antibiotic therapy. Okay. Just cirrhosis, febrile. Okay.
What's the diagnosis here, would you say?
When initially I was thinking, okay, cirrhosis and abdominal pain. Um, I was thinking like alcoholic cirrhosis, but I don't know how much evidence there is for that.
Okay, so let's just say cirrhosis. Okay,
Okay.
but how about, why did they have, why did they do a paracentesis? Um,
There could be like leaking here. I'm not too sure
okay,
why this would happen. Maybe there's like fluid in the
sure.
peritoneum.
Good. So fluid in the peritoneum, and that's why
Okay.
they did a paracentesis, so to pull that fluid out. And then
Okay.
it showed a bunch of polymorphonucleocyte count of 300 cells. So what is that? What does that kind of signify?
I'm just thinking like infection, right? So it's
Okay,
like
good.
it's
Okay,
a
good.
I forget if it's a left shift or a right shift. I can't remember.
Going to be a left shift usually,
Left
and
because
um,
those are like younger leukocytes, right?
exactly. So talk to me kind of if you were to put a diagnosis, so it's a abdominal infection. Do you know what the diagnosis is here?
Of which bacteria? I'm not too sure.
Not the bacteria, I would say the diagnosis.
Um, I don't think I know the diagnosis here.
Have you ever heard of spontaneous bacterial peritonitis?
I don't think so. Spontaneous
Spontaneous bacterial
bacteria.
peritonitis. So that's what this diagnosis is. Can happen if you have cirrhosis and that fluid within your ascites, right, which is a
Hmm.
fluid in the peritoneum, gets infected spontaneously with bacteria. So this is
Okay.
what this woman has, and so now they're asking, okay, so if you have spontaneous bacterial peritonitis, what do you want to do?
I think I'd give something that's pretty broad spectrum. Um, the one here that looks like the most to me would be ceftriaxone, but that's just on a gut feeling. It's not really anything else. All the other ones are pretty specific,
Okay.
um, but I'm not too sure.
Good. So I think you walked through that pretty good. Okay. So just remember, right? Spontaneous bacterial
Bacterial
peritonitis,
peritonitis. Okay.
right? So ascites fluid, right, without any kind of intra-abdominal source, right, that gets randomly,
It's just
randomly.
random that it happens.
Yeah, I mean, there's multiple ideas of how, what's the theory behind it. Maybe a leakage of some bacteria from the gut into the fluid,
Okay.
causing that to, become infected.
That makes sense.
But you want something broad coverage, right? Because there's a bunch of nasty stuff in the abdomen, right? If it gets
Okay.
infected. So ceftriaxone is good for gram positives and gram negatives too, right? It will cover both sides.
That's what I
Um,
was thinking. I was just like, which one of these is the most broad and tolated in its
yeah.
tracks?
So vancomycin, right? Those are usually gram positive, right? Metronidazole is usually for anaerobic infections, right?
Yep.
Doxycycline
DNA,
usually, right, is going to be atypical pneumonia, and then a lot of like,
gram negatives,
yep, infection
vectors.
from like insect bites, things like that. Like at the wild, right? Linezolid, right, is
I
usually
forgot
for
what linezolid was. What is linezolid for?
it's a very very strong for enterococcus, right? Vancomycin
Okay.
resistant things, and also MRSA, right?
Okay.
So just that's like a very heavy gun
So a
for
hospital, like someone had a catheter, based infection or something like that. Okay, from
yeah.
enterococcus. Okay.
So one of the key things learning point here is I want you to be able to recognize, right? I mean, initial treatment, right, is they're not going to ask you too much about initial treatment choices on step two, right?
Okay.
The key thing here that you have to know for step one is be able to recognize the diagnosis, right?
Okay.
So cirrhosis, right, with ascites, you can always have a chance of having spontaneous bacterial peritonitis. Just always remember that.
Okay.